Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips and Practical Tips. What I'm going to be sharing with you today is a nice example of high-grade papillary urothelial carcinoma. So this is a case of a 62-year-old male patient who presented with hematuria. And on cystoscopy, he was found to have a papillary growth that was removed. And as you can see here from the low power magnification, this is actually papillary urothelial carcinoma. If you focus here into the left-hand side, the growth is mostly low-grade papillary urothelial carcinoma. What was peculiar about this case is this area and only this focus that I'm going to zoom in a minute, in which the papillae itself was lined, half of it was lined by low-grade papillary urothelial carcinoma, while the contrasting half, the second half, was lined by what appeared to be high-grade urothelial carcinoma. So zooming in a little bit, so this is the papillae, the fibrovascular core, and then we have here the low-grade papillary urothelial carcinoma with minimal pleomorphism, and then we have the umbrella cell layer, while the opposing half, the second half, showed this very clear disarray of the architecture with loss of polarity, pleomorphism, and hyperchromatic. The contrast between both halves of the same papillae was so clear that it was really eye-catching even from the low power magnification. On even higher power magnification, you can see easily the difference between the growth of the low-grade papillary urothelial carcinoma on one half of the papillae and then the higher grade papillary urothelial carcinoma on the opposing half, on the contrasting half. And as you can see, there is a clear loss of polarity with disarray of the architecture, with hyperchromasia and marked pleomorphism, in contrast to the low-grade component. And even with the low-grade component, you can appreciate some basally located or parabasally located mitotic figures, as well as the umbrella cell layer, while on the in the higher grade component, the apoptosis was clear, as well as the disarray, and even some moving from to another focus, again showing this marked disarray of architecture, even what was suspicious to be mitosis high up in the epithelium, and more mitosis away from the basal and parabasal layer of the epithelium, with the clear pleomorphism and hyperchromasia. So this component was the low grade, and this component was the high grade. Now, in one area, there was evidence of invasion into the lamina propria, and this is clear with the acidophilia of the cytoplasm, the pink color of the cytoplasm, as well as the reaction in the lamina propria. In another focus, there was evidence of invasion, and it's important here to differentiate this from what is known as the inverted growth pattern of high-grade papillary urothelial carcinoma. An important clue is the presence of desmoplasia and inflammatory reaction in the lamina propria. Now, into immunohistochemistry, and cytokeratin 7 is positive in both the low-grade component as well as the high-grade component. What was cytokeratin 7 useful for is to highlight further the areas of invasion into the lamina propria. But what was really beautifully showing is the cytokeratin 20, in which the low-grade component was completely negative, whereas in contrast, the high-grade component showed full thickness positivity with cytokeratin 20. Now, sometimes with cytokeratin 20 in the low-grade component, you might encounter the umbrella cell layer, which is normally positive with cytokeratin 20, that does not make it into high-grade component, whereas in contrast, the higher grade component shows the full thickness positivity with cytokeratin 20, strongly supporting the contrast, the difference between both components on both sides of the fibrovascular core in the same papillae. Quite unusual case. Also, the cytokeratin 20 in this focus in particular, the strongly positive cells are the umbrella cell layer contrasting to the slightly dimmer cytokeratin 20 positivity in the dysplastic, in the high-grade dysplasia, which is known sometimes to borrow, undermine, or to sneak underneath the umbrella cell layer, again helpful to support the presence of a higher grade component, even if we encounter an umbrella cell layer and we're not sure about the diagnosis. P53 sometimes can be useful as well, not in this case because P53 showed mosaic staining pattern of wild type quality of staining. Thus, there was no evidence of difference in the staining between the higher grade and the lower grade components. So the final diagnosis in this case was low-grade papillary urothelial carcinoma with focal high-grade foci. And the reason for calling this focal high-grade foci because these areas of higher grade component comprised less than 5% from the total specimen that was submitted for examination. And of course, we have to comment on lamina propria invasion because this would really alert the physician in order to examine further and perhaps to go again with cystoscopy and to sample the area, making sure that to include muscularis propria. Muscularis propria was not included in this specimen. Remember that what was beautiful about this case is how cytokeratin 20 highlighted and supported the two components, the higher grade component, which was strongly diffusely positive, versus the low grade component, which showed only the focal positivity in some of the umbrella cell layer component. I hope you find this tip useful in your daily practice. Thank you.